Denise, do you want to disable the waiting room?
I just did, Chow.
Perfect.
Thank you. Hello, welcome to the APIC Great Lakes 2024 Educational Webinar Series. This month's topic is long-term care facility reporting, required, optional, and the future. To ensure we can all benefit from this webinar, please keep your line on mute and not hold. Hold may play a message or music disrupting the webinar. If you have a question, please drop it in the chat so that we may ensure your question is brought forward during the Q&A portion of the webinar. There are no continuing education credits for today's presentation. We are excited to announce that the MDHHS HAI section recently partnered with the Michigan Health and Hospital Association Keystone Center to create a comprehensive infection prevention and control training program to support continuous learning in healthcare settings. The series includes 6 courses designed to integrate into an organization's comprehensive infection prevention and control training plans. Participants will receive a certificate of completion for each course, which can be retained for employee training files. There is also a new micro lesson on our YouTube channel, created by our very own Rebecca Batches. This will help you to navigate between the APIC website and APIC Connect, where the discussion boards are, show you how to update your email settings on the APIC community site so you can get real-time announcements, and teach you how to engage in the online discussion boards. If this is something you could use a refresher on or are interested in learning more about, please watch the 7-minute video. It is very helpful. We are also very excited to bring forward APIC Great Lakes Peer-to-Peer Mentorship Roundtable. This is a facilitated time following the APIC Great Lake monthly educational webinars, where members will have the opportunity to share challenges, ask questions, and seek advice from fellow member IPs. All APIC Great Lake members can participate and benefit from this, and the way you can submit your questions is anonymously through our Google Forms. Questions and situations will be presented to the group for discussion. Now it is my pleasure to introduce Sarmed Rezzo. Sarmed earned his bachelor in cellular and molecular biology at the University of Michigan and his master's in public health at Tulane University. Sarmed is the long-term care epidemiologist at the Michigan Department of Health and Human Services. Through his collaboration with facilities, local health departments, and MDHHS units, long-term care facilities, and MDHHS units long-term care facilities receive surveillance of healthcare-associated infection support. Welcome, Sarmed. We are excited to hear you speak today regarding long-term care facility reporting, required, optional, and the future.
Thank you so much, Denise. Yeah, as Denise said, we are going to be talking a little bit about the required, optional, and the future of reporting in long-term care facilities that we are aware of at the moment. I will caveat a lot of the conversation that we're going to have here with it's very fluid, and so there are some things that are going to be changing, and we'll talk a little bit about what those changes might look like, as well as when we're going to find out more information about what that reporting would look like. And again, we'll get into that a little bit later in the presentation. Can we go ahead and move on to the next slide, please? Thank you. So we'll start by talking about our background a little bit. So the Surveillance for Healthcare Associated and Resistant Pathogens Unit, or SHARP unit, was created back in 2009 to help coordinate a lot of the surveillance activities and response activities for healthcare associated infection and prevention of those infections within the state of Michigan. A lot of the activities that we're working with here is to work on improving that surveillance, ability to detect a lot of HAIs that we're seeing in our facilities of various types, including long-term care facilities, as well as to track and hopefully prevent as many antimicrobial resistant pathogens as we are seeing as well. The unit was also created in order to help identify and respond to various outbreaks of disease, as well as collect data to monitor trends, monitor potentially new pathogens as they are entering into the state, and help just continue bolster those efforts. In addition, this unit also educates healthcare providers, state and local public health partners, and the public in general on HAIs, their prevention, and their transmission. I will say, as of right now, the SHARP unit is actually probably going to be renamed, as the structure has changed at MDHHS slightly. So now we are actually a HAI section, and the units are now being split up into smaller portions, such as containment and infection prevention and response. So stay tuned for changes to the way that the structure of the units are currently housed within MDHHS. About myself, my role is the long-term care epidemiologist within that SHARP unit. So mostly I collaborate with facilities, other local health departments, regional healthcare coalitions, other units within MDHHS, such as immunizations or enteric diseases, and other sections that are here at the state regarding activities that are happening in long. I also coordinate surveillance projects on HAI specifically that are happening within long-term care facilities, and actually we will be talking about that a little bit later as well. Next slide, please. Okay, so we'll talk a little bit about where these slides are coming from. Some of them we're creating on our own. However, a large bulk of the reporting discussion and all of the visualizations you see here are actually in conjunction with CDC, so the Centers for Disease Control and Prevention, with the Emerging and Zoonotic Infectious Disease Unit there. And they periodically will do trainings on NHSN, which is the National Healthcare Safety Network, where most of this reporting is conducted and required. So a lot of the training slides that you'll see here that show what NHSN looks like and where all of this reporting is done and how it's done is actually directly with NHSN slide decks there. So if you want to look at the source material, I tried to parse down a lot of these webinars and trainings that NHSN provides, hours upon hours of which, because they go through each individual module in great detail, tried to kind of parse it down to a little bit more digestible pieces and focusing on kind of a broader overview. But if you do want to go in more detail, all of those slides are available to you as well. And I'm pulling from these specific presentations that NHSN has put on, so you can kind of target where you're looking for. Next slide, please. All right, great. Let's go ahead and start talking about the current reporting requirements. Now, I'm going to focus mostly on skilled nursing facilities and their COVID-19 reporting, because that is the major reporting requirement that we are seeing still at this point. However, there are other long-term care facilities who have to do other types of reporting, and I'll briefly touch on that in the next couple of slides as well. Next slide, please. So speaking of these reporting requirements, they do not come from the state of Michigan. They do not come from the NHSN team at CDC. It's actually coming from CMS, and they're the ones who mandate and dictate what these reporting requirements are. So as NHSN says, we would also like to echo that, where if you do have questions about what the reporting requirements are, what the quality reporting programs are, feel free to get in touch with those two inboxes at CMS, because they're going to be the experts on what the most up-to-date reporting requirement is for your facility type, as well as if there are any questions, which I'm sure there usually are, about what the future of reporting requirements will look like. They are the ones who definitely have the most information about what that might look like. And long-term care facilities that are not skilled nursing facilities can use the top DNH triage team email inbox, and then skilled nursing facilities can go directly to the SNF quality questions CMS inbox. Next slide, please. Okay, so let's talk about a couple of the actual reporting requirements and what they look like. So first and foremost, for non-skilled nursing facilities, you do need to be continuing to report when you are seeing positive cases, just like any other facility type of COVID-19, because that is, again, the one continued mandated reporting requirement. As with other facility types, if you do have any infections that are reportable conditions in the state, and we have a series of state reportable conditions, those are also required reporting for any facility type that is of required reporting, which I know long-term care facilities are also a part of. As for skilled nursing facilities, on top of just generally reporting when you do have a reportable condition, which COVID-19 is one of them, there are a couple additional reporting requirements that were levied by CMS, and these include the COVID-19 surveillance pathways, as well as the COVID-19 vaccination modules for skilled nursing facilities. These are located in the long-term care facility module of NHSN, which is, again, CDC's web portal for, it's called the National Healthcare Safety Network, and it is for where that reporting would be conducted. So CMS certified facilities are required to report at least once every reporting week for both the surveillance pathways and the vaccination module. However, these reporting requirements are slightly different, and we'll talk about that in a little bit further in this presentation as to what a reporting week looks like, because they are technically different between the surveillance pathways and the vaccination module. In addition, there is, for the quality improvement programs, there is quarterly reporting as well for staff vaccination for facilities who are participating in there. And so those reporting requirements are also required to be conducted. And again, that's just going to be staff vaccination data for COVID vaccination. And after the weekly reporting requirement expires at the end of December of 2024, that reporting will have to continue just like acute care facilities have, which is 1 week out of a month. You would need to continue that reporting in order to stay in compliance if you're part of that quality improvement program with CMS into 2025. Next slide, please. Okay, so now we're going to talk a little bit more detail about what the differences are between the surveillance reporting pathways and the weekly COVID-19 vaccine data reporting module. So for the surveillance reporting pathways, they are due every 7 days, just like the vaccination reporting module is. However, the surveillance reporting pathways don't have a set reporting week. All they require is that at least once every 7 days, you're required to submit a report. And each report is supposed to contain data. So this is going to be your COVID cases, COVID deaths in residence, staff COVID cases, hospitalizations, that kind of information. And those are going to be required to be at least once every 7 days. You can actually submit, if you choose to use NHSN as your general tracking system, you can actually submit every single day of the week and only include additional cases and all of the metrics that are included in the reporting pathways. You can choose to only report each day by day from 1 day to the next. If you choose to only report once per week, then you would just report from the last time you had reported, which would have been 7 days ago. There are 2 pathways that remain in this pathway module. That is going to be the resident impact and facility capacity pathway and the staff and personnel impact pathway. That's going to include, again, the newly positive test results for both resident and staff, vaccination status of the COVID-19 cases in residence, deaths in residence, hospitalization, and the vaccination coverage of those hospitalizations for residents. So staff really only has one question, whereas residents has a series of questions in that pathway data. Again, we will talk about that a little bit further, and we'll actually show an example of what those forms look like as a little bit of a refresher. In terms of the vaccination data reporting module, it is also due every 7 days. However, there are a couple different methods with which you can use to report into this module. The summary for the vaccination is required. However, there are 2 different ways you can actually reach that summary. You can either directly summarize by counting your individual residents and staff members, or you can actually use an optional NHSN person level version of the vaccination module, and that would allow NHSN to calculate those up-to-date metrics on your behalf based on the most recent definition. In addition, the vaccination reporting module is not as unstructured as the surveillance reporting pathways. There's actually a set week that the vaccination data reporting module requires. So that reporting must be conducted between a Monday through Sunday week. So as a good example here, the data that is covering the week from July 8th of 2024 to July 14th of 2024 is going to be due on July 21st of 2024. So you have 7 days from when that period of data that you are collecting over finishes in order to actually submit that report. We can go ahead and move on to the next slide, please. Now, where in NHSN are these different pathways located? So once you log into NHSN, you will have a welcome to NHSN. You'll reach the NHSN long-term care facility component homepage. And these 2 pictures are actually showing the left-hand navigation bar in NHSN. It will show where you need to go in order to reach these data modules and submit data into them. So on the left-hand side, you'll see COVID-19 is its own section. And then under that section, you have several different options you can pick from. You can pick from the pathway data reporting. That will take you straight to the surveillance pathway portion of the module. And then you can also pick one of the bottom sections here, which is the COVID-19 vaccination for healthcare personnel, COVID-19 vaccination for residents. These top 2 are actually the summary version of the form. However, if you wanted to use the optional person level, that would be the bottom 2, which would be person level COVID-19 vaccination form for healthcare personnel and the person level COVID-19 vaccination form for residents down as those lower 2 options on the right-hand side. Next slide, please. So let's give a brief example of what these data reporting forms look like. Again, NHSN has an exhaustive set of definitions for what they all are, what should and should not be included in any of these reports. So please check out NHSN's website for more information on all of that specifics and all of those details. But we're just going to provide a broader overview of what that looks like right now so that you could be aware of kind of the basic requirements for reporting. Next slide, please. So we'll start with the resident impact and facility capacity pathway. So this is a reporting example for what that sheet looks like. You're going to, at the very top, talk about your positive tests, how many positive SARS-CoV-2 viral test results for COVID-19 you've had since the last time you have reported. You'll have of those, so in this case, there were 2 positive tests. Of those positive tests, how many of those individuals were up to date on their vaccines? How many were not up to date on the vaccines? That not up to date will automatically calculate based on how many were up to date. So in this case, you enter 2 for positive tests, you enter 1 for up to date, and NHSN will automatically put the other 1 as not up to date. For hospitalizations, which is the next section, you'll have to enter how many of those positive tests were hospitalized. I apologize. How many of those individuals had a positive COVID-19 test and were in the hospital. And then the second subsection of that hospitalization section is whether or not they were up to date on their vaccines at the time of the hospitalization. finally, you'll have resident deaths at the bottom, and that will be the total number of residents who had died for any reason. And then the sub question within there is, of those, how many died with COVID? Next slide, please. As for staff, it's a much simpler pathway to actually report into. There is only one question: how many positive COVID-19 SARS-CoV-2 test results did you have, and did you perform? So that's a much easier pathway to report into. It's only a few minutes, so pretty straightforward there. We can go ahead and move on to the next slide, please, which will be the weekly COVID-19 vaccination resident form. Now, I will say up to date is a consistently moving target. And so who is considered up to date changes on a regular basis. It's actually every quarter, NHSN will reevaluate what up to date means and determine if that needs an update to the definition or if the definition will remain stable for that quarter. So you're still going to have to fill out this portion, which is of the number of residents you've had staying in your facility, how many of them were up to date. And then to talk about those who are not up to date, was it because of a medical contraindication? Were they offered but declined? Or was there some other unknown status for that vaccination? I will say there is a lot of mathematical logic for these forms. So for instance, you need to make sure that the number of residents who are up to date and the number of residents who are not up to date, all of those need to equal the total number of residents you have staying in the facility during that week of data collection. So you do need to make sure that those forms kind of all match up in terms of the broad numbers. Next slide, please. And this is the weekly vaccination healthcare personnel form. Very similar to the resident form, actually. However, you do have the categories of what type of employee healthcare personnel are you talking about. Is it, other contract personnel, volunteers, licensed independent practitioners, employees that are directly on payroll, and then, of course, all of the core and all HCP categories are grayed out because NHSN will actually calculate them for you based on who's a core HCP on payroll and then who's a non-employee healthcare personnel. So all those questions are still the same, whether you're up to date, medical contraindications, offered but declined, and unknown. And again, that math is still required where the sum of each column has to match the top row for number one. If you add number 2 and number 3 up, those need to add up to 1. So that's the general summary form for both resident and staff. We'll talk in a little bit about actual optional reporting, which is a little bit different version of this form, but will still come out to the same result. And this is the part that is required per CMS reporting requirements for skilled nursing facilities. Moving on to the next slide, please. Okay, so let's talk about other reporting requirements. Now, some of these are less frequent or more frequent. It really does depend on kind of the circumstances here. And we'll start with point of care test result reporting. Now, point of care test result reporting for tests that you are conducting on site is still required to be reported because COVID is a reportable condition. As a facility, you are supposed to be reporting that. And this is going to be all individual point of care test results that are positive for COVID-19. However, because we know, and CDC is also well aware, that the burden of reporting is very, very significant, especially when you're conducting all of this point of care test results. There are a few options to kind of help assist you. So batch CSV uploading is available on multiple platforms in order to make it a little bit easier for you to report multiple tests at the same time. These tests are actually due within 24 hours of when you're performing the test. And you have 3 available methods with which you can do so. You can either directly contact your local health department, and some health departments will want you to utilize one method over another. And you can obviously have a conversation with your local health department of how they would like to receive those test results. You can actually use NHSN, again, National Healthcare Safety Network, the federal reporting. The NHSN point of care test result reporting module, as well as the other available method, which is the MyBridges antigen reporting portal. Both of those will actually directly import the data from those two reporting modules for your local health department to be able to manage. So some local health departments will prefer that you go directly into NHSN or the My Bridges portal in order to make it a little bit easier for data entry. As for the My Bridges portal, that's actually only available until August 17th. There is a new reporting method to come. And if you are currently using that portal, you're going to need to reach out to the email address that is available at the top of the reporting page. I believe it's MDHHS_MDSS@michigan.gov. But again, once you log into the My Bridges portal, it'll show up right there at the top, stating that you would need to contact them to figure out a new reporting mechanism. If you are a skilled nursing facility, it's a very good idea to just utilize NHSN's point of care because we know that is going to remain consistent. And that's one less thing that you'd have to transition over to because NHSN is going to continue providing that reporting support. Moving on to other reporting that is also still required, but not as frequent, is the annual healthcare personnel influenza vaccination reporting. So that is due every year. One report per year is going to be required, and that's due on May 15th. It covers an annual influenza season. So it's October 1st through March 31st of any following year. So for instance, this past influenza season was October 1st of 2023 through March 31st of 2024 and was due May 15th of 2024. That is actually required to be reported to a different location than all of the other reporting that we're talking about here in NHSN. It's required to be in the healthcare personnel safety component. And if you're from an acute care facility, you're probably already familiar with this component because that's typically where a lot of acute care hospitals are conducting their required reporting. But for long-term care facilities and SNFs specifically, if you're CMS certified, you have to also have access to this component, and only your facility administrator, the person who has the facility administrator role in NHSN, is going to be able to request and grant access to that component in NHSN for you. Let's go ahead and move on to the next slide, please. Now, where these two are located, the point of care test result reporting is also located in the long-term care facility component of NHSN. So right next to the COVID-19 reporting and where you see the pathway reporting and the vaccination reporting, the point of care test result reporting is also within that COVID tab. I will say this version of the slide, which shows COVID-19/respiratory pathogens and has slightly different menu options, is actually more up to date than the slide that I showed you previously. CDC hadn't updated that slide to indicate the new menu options that they've shown here, which is actually what it looks like in current day. I'll also point out the healthcare personnel safety component page. The portion on the right is showing that that is where under vaccination summary and annual vaccination flu summary, that is where you will find the reporting that you would need to do there. As a reminder, that is not located in a long-term care module. It's in healthcare personnel safety components. So you would actually need to go back to the home page of NHSN and log in under a different component in order to access this, which you would do once a year in order to conduct that reporting. I also want to point out just a brief note that the find button here is actually my view. Everyone will have a slightly different view based on your permissions in NHSN. So you might not see that find button. You might just click on the annual vaccination flu summary and it will immediately show up for you. Next slide, please. Okay, and as I talked about a little bit before, a lot of the information I'm talking about today and all of these forms, I breezed through very, very quickly. And I gave you just a high-level summary of what that all looks like. And I do want to remind you that NHSN does have significantly more information on their website to go over each individual item. You can go over what the individual pathway forms look like, where the table of instructions are, includes all of the definitions and what should or shouldn't be included. You have all of the slides that I'm showing from here that CDC had shared, as well as YouTube recordings of every webinar that they've done, over all of these topics. So feel free to check out the NHSN long-term care COVID module webpage in order to get all of that additional information and the extra context included there. Next slide, please. With the time we have left, I wanted to start talking about a couple different optional reporting that we have available and what that might look like for your facility. Next slide, please. And we're going to start by talking about the person level forms. Now, I'm not going to go into too much detail. Again, NHSN has multiple webinars, one of which is entirely dedicated just to this person level reporting form, which you can look up in more detail at a later date. But the idea is the person level forms will adjust the definition for what COVID up to date looks like on its own for you. You don't have to know on a quarterly basis what everyone's or what the current up-to-date definition is. You don't have to calculate it on your own every week when you're reporting. You would just make sure that all of the individuals in your facility are entered into NHSN with their vaccination dates, and NHSN will then apply that information for you. Just as a quick note, the up-to-date definition did change again for April through June. And I believe the new July definition has not had any changes as far as I am aware, but NHSN is also going to be talking about changes to the module briefly, and I'll talk about that in a minute. As of right now, the definition is showing that individuals are up to date if they are under the age of 65 and they received one dose of the updated 2023-2024 vaccine, they are up to date. If you are over the age of 65, and you've received one dose of the updated vaccine and it was in the last 4 months, you're up to date. Or if it was older than 4 months, then you would need to have 2 doses of the updated 2023 to 2024 COVID-19 vaccine in order to be considered up to date and you were 65 years and older. So the definitions are sometimes complicated, sometimes age dependent, and sometimes not. It really does depend on a quarter-to-quarter basis as to what that definition looks like. Next slide, please. And again, there are tons of resources on if you want to actually switch to do this person level reporting. It is optional. You don't have to do it this way. You can absolutely do it the other way, which we showed earlier, where you just say we have 127 residents as an example, and 115 of them are up to date. And then here's the rest that are not up to date. You can absolutely do it that way, and that's still going to fulfill the reporting requirement. But if you would like to do the person level form and just mention when each individual person was vaccinated, it will then calculate whether or not those folks are up to date for you. And again, NHSN has plenty of resources on their website in order to be able to implement that optional reporting if you would like to go with that option. Let's move on to the next slide, please. Now let's talk about a little other optional reporting and what we're expecting to see moving forward. So we're going to talk about the flu, influenza, and RSV, which is the respiratory syncytial virus, case and vaccination reporting. So that is a newer reporting that is currently optional in NHSN. Next slide, please. And looking at this, I wanted to show just briefly what the current reporting requirements look like under pathway data. This is where actually all of this additional data is also going to be located. And we talked about this earlier, but when you're talking about the resident impact and facility capacity pathway and the staff and personnel impact pathway, they have a handful of required reporting in those forms that we showed you earlier: newly positive tests, whether or not those people who are positive were up to date, for residents, whether they were hospitalized, and hospitalized and up to date as their status for their vaccines, as well as any resident deaths. And then for staff, newly positive tests is the only question. However, you can optionally actually answer a very similar question for influenza and RSV. All of these resident questions, whether they're how many positive tests do you have, how many were up to date, any in the hospital, were those up to date, and deaths, those are also included for the flu and RSV. So next slide, please. And so what you can do is once you're in the reporting pathway, you can see on the left-hand side are the first two tabs. Those are the two required tabs for resident and staff. However, you can actually go over to the RSV and influenza optional tab, and you can actually fill out this data for those as well. What NHSN does ask is that you completely fill out each individual pathogen. So if you are reporting for influenza, then you would need to do the positive test question, the vaccination status questions, and then the hospitalization questions. And then same thing for RSV. You need to complete that portion of the optional in order to make sure it's marked as fully completed. Now, that's going to be for the pathway data. However, if you go to the next slide, you can actually see it also exists for the vaccination summary portion as well. And again, COVID-19 vaccines for residents and healthcare personnel are required. However, influenza and RSV are not required. So for the COVID-19 reporting, just like with the pathway data reporting as well, you cannot enter information into the influenza and RSV optional portions of NHSN without first completing the COVID-19 forms. So if you want to report into, let's say, vaccination here for influenza, you have to finish both the resident and healthcare personnel COVID forms first, because NHSN wanted to add an extra logic to force you to do the required reporting before moving on to the optional reporting to make sure that you do complete those. You would continue to report the COVID-19 as per CMS requirements. They're still required. One nice thing about these optional forms is that anything that might carry over will do so. So for instance, question 1 for the resident form from COVID, which is what is the number of residents you have, that will automatically copy over to the influenza form for you. So it's one less thing you'd have to enter if you're doing this optional additional reporting. Next slide, please. And here's what that optional reporting looks like for, again, the vaccination summary portion of NHSN's reporting. That information will include, again, the total residents that gets carried over from the COVID tabs. And then you'll have 4 additional fields, which is how many were up to date, what was the number of medical contraindications, offered but declined, and then number of other unknown when it comes to flu vaccination, as well as RSV has 4 of the similar fields, which are for RSV's vaccination. And that will be the number of residents who are up to date, and then the 3 sub-questions for those who are not up to date. And again, just like in the rest of the COVID-19 vaccination reporting, all of those questions for number 2 and number 3, those sub-questions must add up to the total number of residents in your facility. So if you do receive an error, you just need to double check and make sure it all adds up correctly. There may be someone that you maybe need to recategorize or add to another category if you filled it out slightly differently. Next slide, please. And so what actually do we want to see in these optional reporting? So first, I will say, you can choose to report into both the influenza and RSV vaccination questions if you choose to. You can do only one, which is only the flu or only the RSV. You need to do, though, both pathway data as well as vaccination data for the pathogens you're choosing. So for instance, if you want to only do influenza reporting, you would want to do then the pathway data influenza optional tab, as well as the vaccination summary influenza optional tab. Ideally, you should be reporting in that same weekly cadence as COVID-19, but you can choose how often to report this optional data as well. And again, as I mentioned before, if you report any data in a field for either of these optional reporting sections, you would have to complete all of the questions for that associated pathogen. So if you start doing one of the questions for influenza vaccination, you have to finish all of the influenza questions, which is really section 2, those 4 categories there for up to date, and then medical contraindications, offered but declined, and other or unknown. Next slide, please. Now let's talk about why we would want to do this optional reporting. It is an additional burden. It is a little bit extra time out of your day or out of your week. However, there are some benefits of actually doing this extra reporting. First off, you get additional visibility into the respiratory illness of cases within your facility. It just kind of helps track and keep an eye on things as especially these seasons progress. When we're in the middle of respiratory season, it's a good idea to know what respiratory conditions you have floating around in your facility, which ones are spiking when, all of that kind of information. In addition, NHSN's portal, if you are reporting into these modules, will provide you with a series of analytic tools that help you track that information over time, especially if you're consistently reporting. We do recommend reporting on a consistent basis because that does help you keep an eye on things over time. You can then share some of these reports and analytics that show up with your C-suite. And it does just help you keep an eye on everything going on within your walls. In addition, we're working on implementing additional support for facilities that are reporting this optional data with extra infection prevention and outbreak management support from MDHHS. We're actually looking to implement that hopefully by this coming respiratory season, where you'd be able to actually take a peek at all of those analytics for you, keep an eye on them, and kind of ping facilities if they do need additional support for infection prevention purposes. We can obviously help tag team some of these additional resources for you. Finally, it does help CDC and on the federal side to have a little more clarity on where resources and funding allocations should be going, especially since we don't have as much visibility on all of these metrics in long-term care facilities. It is a good idea just for future respiratory seasons to be able to see what that burden is within our walls so that we can further help get support from state and federal agencies as well. I actually did see a question that came in and I wanted to go back before we move on to the next slide. If we do the person level version of the vaccination summary, will we still have to input data or will it just pull from that as long as long-term residents do not change weekly? So that is actually one of the benefits of doing that optional reporting, is that if you are using the person level form, you don't have to input data on a weekly basis. You just have to confirm that the data is accurate. There's just a button where you say submit, and that submission will then be performed for you. So it's a little bit easier on a weekly basis, but it's a lot more work to set it up initially. But if you don't have a lot of change in your residents, it's usually worth it because that weekly reporting burden would go down. So that is a benefit of doing that optional reporting if you're interested. Let's go ahead and move on to the next slide, please. Okay, so now let's also talk about healthcare associated infection reporting. We're just going to shift topics here a little bit. Once again, this is optional reporting. Thank you for advancing that slide. This is optional reporting. It's not required. But we do want to talk about how it might be valuable and to give a little bit more information for folks. So I'll start out by saying CDC has had an increase in funding recently, and they're targeting an attempt to improve the use of NHSN as a way to track and do HAI reporting. NHSN is attempting to increase enrollment of that HAI reporting into the long-term care facility component of NHSN for us. So as of right now, there's only a handful of facilities that have been reporting this HAI data. We know it's a very heavy burden in order to report it into NHSN's component, and we are looking to change that. First and foremost, a lot of this initiative is an attempt to bolster the use of NHSN as a way to track HAIs and to do that reporting in long-term care facilities on an optional basis at the moment. Another big component here is trying to identify areas of healthcare-associated infection prevention and control, and try and implement countermeasures within long-term care facilities. A lot of additional focus we're having as well on increasing adherence to the prevention process measures, things that can help interrupt the transmission chain of these HAIs, and just kind of making sure that we are adhering to those best practices, as well as just improving and standardizing HAI surveillance across the board. We know that kind of every facility has their own way of tracking, and NHSN has kind of a standardization format that would allow that standardized surveillance to be conducted and would improve that. In addition, we are also looking, especially within skilled nursing facilities, on increasing our understanding about how these healthcare-associated infections are transmitted, both within the community around you as well as within our facilities walls, and just in general, reducing healthcare-associated infections, incidence and prevalence within our communities. Next slide, please. Okay, so briefly, we're going to talk about benefits, right? Enrolling into the component and the benefits that that would provide. Next slide, please. Okay, so let's first start by talking about data. So the benefits of visibility of HAI data in the long-term care space, you'd get additional awareness of what those infections are in your facility, what are areas of improvement, which conditions should we be focused on looking for, and you can actually inform additional action for infection prevention purposes, and to be able to track progress on all of these actions and interventions that you're conducting. In addition, MDHHS will actually also generate a series of monthly reports for participating facilities and provide additional support from not only the MDHHS SHARP unit, but also the infection prevention unit and help collaborate with multiple agencies here in order to help reduce those burdens of HAIs and in general, just improve patient safety. That's one of the biggest components that we're looking at here. As you can see on the right, this is one of the reports that MDHHS actually generates, showing what does, out of like the wider group that we have, what is the number of SUDIs you're seeing on a monthly basis, which is symptomatic UTIs, symptomatic urinary tract infections, and what is the rate among the number of resident days that those infections are occurring, so we can kind of track not only how many infections are we seeing, but how many resident days does it take for those infections to occur. And NHSN does provide a lot of these real-time analysis tools that help inform graphics like this. NHSN provides those facilities or those analytic tools directly to your facility. If you are reporting into this module, you can actually download some of these analytics yourself, and you can share that information with clinicians or C-suite facility leadership in order to help inform different strategies that your facility might want to utilize in order to help prevent some of these healthcare-associated infections. Next slide, please. In addition, you're actually going to receive facility-specific technical assistance and extra collaborative opportunities. And actually, earlier today, we did have a small work group similar to NHSN's work group for the hospital component, where we discussed some of the recent changes that we've been seeing, discussing best practices, different topics that folks would be interested in covering, such as enhanced barrier precautions or what the current month's data looks like, additional training and learning opportunities, other topics and updates of interest. So I wanted to point out kind of there's a lot of information and value to be gained out of these work groups. If you were to join, you'd also have access to subject matter experts who'd be able to answer any of those questions for you. And you can also review those reports that MDHHS generates for you. For instance, this hand hygiene and gown and glove rate use graph showing just kind of what those rates are looking like on a month-to-month basis. Moving on to the next slide, please. Now, another big component here is actually additional educational resources. So a portion of the CDC SHARP Project 4 funding can go to facilities if you are going to participate in this additional optional reporting. Funding is designed to be used for professional development of staff for infection prevention purposes. The incentive is actually $2,500 to be spent by September 30th of this year. You can use it for conferences, meetings, guidelines, textbooks, memberships to infection prevention organizations. And in order to be eligible for that funding, you actually have to do C. diff and multi-drug resistant organism, as well as urinary tract infection reporting, which are required to be eligible for that funding. But then prevention process measures is optional, but strongly encouraged. Next slide, please. So who should participate? Engage facilities who have the capacity to conduct HAI reporting, who have knowledgeable staff for healthcare-associated infections in their facility, and then buy-in from your leadership as well. Next slide, please. And I'll talk very briefly because I know we're running out of time here. NHSN has a series of reports and additional resources that you can work with in order to kind of work with that HAI data. Next slide, please. So they have a standardized surveillance criteria and analytics. So you can actually look through all of these definitions for these modules and know how to report each of them. Just like the COVID module, every single pathogen has its own definitions. It has its own protocol. And so it's very standardized and relatively straightforward. Next slide, please. And these are the reports that I was talking about, some of these analysis reports. You can see CDI module has individual MDROs and C. diff, where you can actually see what those events look like. You can see the UTIs. And then you can also have additional CMS-based reports. And just like the COVID module, you have a whole series of extra reports that you can look into and utilize those analytics internally. Next slide, please. And I'm actually going to breeze through these slides because we're running low on time, and I have a couple other things I want to talk about. But there are, again, that same resources available for each individual pathogen. NHSN has its own website and its own protocol, introductions, trainings. Next slide, please. Same thing. This is pathogen specific for the multi-drug resistant organisms and C. diff. Next slide, please. As well as urinary tract infections having its own dedicated page with all the instructions, all the forms, and all the protocols and trainings that they've done. Next slide, please. So if you're interested in participating, you would just have to sign an agreement to participate and letter of intent to this optional program. You'd have to sign up for NHSN's module, the monthly reporting plan for it, and then begin conducting that monthly reporting. And then you'd be added to a participating facility list to get additional info, get added to the work group meetings and further instructions. Next slide, please. And this is just a brief summary of all of the benefits for doing the healthcare-associated infection reporting that's optional, that we talked about a little bit earlier, just the educational resources and professional development funding. You get extra expertise and familiarity within the module, access to the user group for questions and conversations, and best practices, real-time data analytics that would be additional on top of the COVID ones you already received. You can share that extra data with your clinicians and leadership to leverage your internal resources. You can get assistance from the HAI section in order to help lower that HAI burden for you. And if you're already using NHSN and you're already actually doing this data, then share that data with the MDHHS NHSN group, and that actually counts as participating in this initiative. So you would receive those additional resources to help you understand your data. You would be eligible for that educational development incentive, as well as you would get local quick prompt responses to your questions instead of waiting for NHSN. Next slide, please. And with our last couple of minutes, I want to talk about what the future of NHSN may or may not look like, and hopefully have a little bit of an answer for what that might be. So we'll move on to the next slide, and we'll talk about upcoming training. So unfortunately, this meeting is slightly before NHSN is going to give us a ton of information. There's actually a 3-day training for post-acute care, which is going to include long-term care facilities, dialysis facilities, and it's going to cover a vast amount of information. It's going to be July 23rd through the 25th. They're going to talk about what the future of NHSN looks like. They're going to talk about what required reporting might look like, and they're going to go over a whole bunch of information. So I did include here a registration link. We do strongly recommend you have someone from your facility actually access this training and kind of be up to date on what NHSN plans to do. They'll go over the current reporting, and then they'll probably go over what future of reporting might look like. Next slide, please. Now, in terms of what we know the changes are going to be, I actually do have just a couple of small things. So one, if you are using the antibiotic use and healthcare-associated infection part of the long-term care module, you might see some changes as well before January. I believe they're in September. There are going to be small updates, but they're not necessarily going to be anything that you would directly be engaged with. However, the biggest known update that NHSN is going to have in the long-term care module is going to be in January of 2025. So as of that date, there are going to be some updates to demographics variables. So sex at birth and gender identity are going to be additional variables in demographics in these modules, and they're going to be required to be filled out. In addition, as of right now, you can only enter one race option. Well, there's going to be the ability to select multiple race options as of January 1st, and race and ethnicity will go from optional fields to required fields. So we do know those updates are coming on January 1st for sure. So these are the known updates that we see. There's also, again, that antibiotic use change that's going to happen that wouldn't actually affect anyone. It's unsure if the person-level COVID-19 forms are also going to update with these changes. It was not marked in the newsletter that NHSN put, but the NHSN training in a couple of weeks should provide much more context on what this specific update and the upcoming changes here will look like. Let's move on to the next slide, please. Now, in terms of what future possibilities, I will very, very heavily preface this, that everything on this slide is speculation, and we will know for sure as of later this month when NHSN formally announces these things. As for RSV and influenza, I know that those were optional at the moment, and NHSN is going to be talking about them at the upcoming training. The webinar is titled Respiratory Tract Infection Pilot Project, The Importance of Respiratory Pathogen Reporting. There is a possibility that in maybe for this 2024-2025 season, respiratory season, NHSN might translate this optional reporting into required. Again, we're not sure if that's going to be the case, but as of right now, it's still optional. We will find out in a couple of weeks whether or not they intend to make it required reporting. As of right now, they haven't announced it, but there is a possibility, given this title, that they might make that change. As for HAI reporting, and I did see Chow actually also ask this question, whether we anticipate the LTC HAI reporting to be required in the near future. I honestly don't know. From the last couple of webinars that we've had with CDC and NHSN in terms of what they might be expecting, it sounded a little bit more like they were leaning towards maybe the RSV and flu optional parts becoming required at some point, and maybe further down the road, they might consider HAI reporting being required. But at the moment, it didn't seem as though there was any concrete plans for that to become a thing in the near future. It might be longer down the road. I'm not sure. Unfortunately, I don't have that information. I wish I did. And next slide, please. And that was actually it for me. Again, thank you all so much. Do appreciate your time. And if you do have any extra questions, happy to answer them to the best of our abilities.
Perfect. Thank you so much, Sarmed. Always love listening to you talk, and you're so passionate about this, and you know every detail about all the things, which I think is very refreshing in a world where there's so many unknowns. So thank you for sharing your knowledge and your expertise with us. I know we just have a couple minutes left, and you've been very diligent about answering all of the questions in the chat as we've gone along. So I do want to pause and just give folks a minute if there are questions. Feel free to unmute yourself and ask verbally. The chat box is certainly always open as well, but just want to give you an opportunity to ask any questions of Sarmed that you might have before we move on to our last agenda item. And if not, I know, Sarmed, you put your contact info here. You can always reach out to us at APIC Great Lakes, and we can connect you with Sarmed as well. So certainly don't feel like this is your last opportunity ever to talk to Sarmed. I know he's very accessible. So feel free to reach out to him or to any of us, and we're happy to connect you with him. So just a couple brief announcements from the APIC Great Lakes side to close out for today. Just a list of upcoming events we have. Our August webinar will be presentations from our chapter members, from poster presentations, oral presentations that they've done either at APIC or SHE. So excited to hear from a large group of folks in August. And then October is our fall conference, and still planning what November will be. So more to come, but save the date for those. As always, all of our sessions are recorded and posted on our APIC Great Lakes YouTube channel. So if you haven't had a chance to look at that and subscribe to it, feel free to do so. It's great watching the engagement we've had there. So if you've not come and joined in, we would love to see you on the YouTube channel. And of course, all the slides from these events are posted on our website as well. Both the links are there. So you will have all of this in the follow-up email, and you can click through any and all of this as you choose. And then last but not least, another plug or reminder, if you have job openings in your facility, are aware of infection prevention positions that are posted, please send them to Rebecca. You can reach her via our APIC Great Lakes Gmail account, which is there on the slide, and we can get those posted on the job board. Separately, if you're looking for a new job, I would encourage you to look at the job board. We keep this very up to date, but certainly rely very heavily on our members and the chapter at whole to tell us what jobs you have posted. So please utilize this. I'd really love to see this grow and really be a strong resource for our chapter and our infection prevention community at large. So with that, we will go ahead and close out our webinar today. Again, echoing Chow's comment in the chat. Sarmed, thank you so much for your presentation. Thank you to all of our attendees for joining us. I know long-term care is something that we've heard loud and clear from our APIC Great Lakes membership. That is a topic that we want to revisit and want to spend more time on. So really appreciate both, Sarmed, your knowledge and the engagement of those who joined us. So with that, thank you. We will close out today's webinar. Stay safe, and we will see you next month. Take care, everyone.